As the second wave of COVID-19 hits Nigeria and some countries across the world are already entering a second lockdown, the Presidential Task Force on COVID-19 has appealed to Nigerians not to lower their guard on preventive protocols, just as they advised against unwarranted interstate travels to curb community transmission and forestall the surge in the already increasing numbers of COVID-19 cases across the country. However, with the Yuletide season and the celebration that characterized such festivities, Nigeria has begun to experience an increase in COVID-19 cases as seen in the daily figures coming in from the Nigeria Center for Disease Control. Experts have been emphasizing the need for Nigerians to take precautionary steps by way of educating the public to be conscious and take responsibility for themselves, their safety, and that of others. On account of this, what is the adherence rate of Nigerians to COVID-19 safety protocols, and how aware is the public of the second wave of the pandemic? Now, these are some of the questions begging for answers on Nigeria Today. Welcome to the program. I'm Chiwobi Walter Nudge. Glad to have you with us, and in the studios to discuss COVID-19 and taking responsibility is Dr. Isaac Akuma Egboja. He's a public health expert. Welcome to the program, sir.
You're welcome. Good evening.
Thank you very much. And also with me in the studio is Ikaru Atar. He is the head Media and Enlightenment FCT Enforcement Task Force on COVID-19. Glad to have you once again in the studio with us, sir.
Always a delight being on NTA and sharing our moments with friends and family.
All right, so let's begin to put this topic into perspective. I'd like to start with Dr. Akuma. What does it mean, to take responsibility, and, what is the level of awareness among the populace?
Well, what it means, first of all, before I say anything, let me, as usual, thank all people that are fighting this pandemic, especially health workers, particularly doctors and nurses who have put their lives on the line. In the last few days, last week, we've lost a lot of doctors, unfortunately, and I'm sure it's not only them.
20 of them particularly.
Some nurses also. We console members of their families and continue to thank everybody for the sacrifices they are making, especially those of them that are making supreme sacrifice. I want to thank NTA also for giving this enlightenment to the public. Well, what it means actually is that first of all, messages have gone out, guidelines have been issued, but people are not adhering to them as strictly as they should. And taking personal responsibility means that even if somebody else doesn't do his own or her own part, you or I as a person will do my own part, or you will do your own part, and that you will not be expecting somebody else to cater for you, to look after you as if you are not capable of looking after yourself. If we think of children or those who are bedridden or who are disabled in one way or the other, and other people have to look after them, then that is justified. But for people who are normal, it is not justifiable that somebody else is expected to look after you instead of you looking after yourself. That is what taking responsibility means. Taking responsibility means look after yourself, look after those around you, make sure that this pandemic comes to an end as soon as possible, and that we get rid of this virus.
All right, so Mr. Ikaru, you are, part of the team. You are heading the team, on enforcement for the FCT. Do you see it from a different perspective, talking about taking responsibility?
Yeah, I think from our own end, we've always told people this, thanks to the health practitioners going forward, that we should obey the health protocols. We are not health workers here, but we've been told clearly well that if we obey health protocols, we will be safe. That means we follow the non-pharmaceutical approach to actually fighting and reducing the spread of the deadly coronavirus or COVID-19, as it is popular now. Most times, people, after the first wave, when things subsided and the numbers dropped and declined, and the curve was flattened or even almost eradicated, many persons went off their guard, and like the biblical injunction said, while men slept, the enemies came and sowed tares in the field. And that may apparently be what played out here, and we got the second wave with us, and many persons are really just laid back. Some of them even had what someone described as COVID fatigue. They just felt, hey guys, it's time for us to live our lives. If anyone die, anyone who is to die will die. Those who will be alive, but we felt that is grossly inappropriate here. And most persons, when we talk about taking responsibility, that means you must own the process here. You have your face mask on, you wash your hands regularly, you use sanitizers, you are very careful, you keep physical distancing. In all of this, when you go through this process here, you will be safe. But like what we see, sometimes we get disappointed, but yet going forward, we must ensure that lives are saved. And as I told someone yesterday while we shot the Millennium Park, I told him, we'll save you against yourself.
Yeah, Dr. Abuja, Akuma, sorry, a lot of your colleagues, are of the opinion that, the second wave of COVID-19 is more deadly than the first, one we saw in the first phase. How safe really are we in the second wave of the pandemic in this country?
No, we're not safe. In fact, if anything, we're supposed to take extra precaution. Assuming that we were doing what we started with during the first wave, we should be increasing our activities and taking more responsibility for ourselves and for others around us. Unfortunately, it is the other way around. It is now that we are not doing enough. This virus that that is coming from Europe now, South Africa, is more deadly than the first one. This variant is more deadly than the first one, and you could see that the spread, the numbers in during this second wave are higher than we had at the beginning. And that means that we are being warned, because we do not yet know how far this will go. We do not yet know when we will reach a point where it will plateau or flattens to a point where we would say we have won.
All right, I'd like you to hold that thought, because you've raised a number of issues, and I would really want you to talk about the new strain of the virus, that's been ravaging countries in the UK and other parts of the world. But then, Mr. Ikaro, some Nigerians seem not to believe that COVID-19 is real. How can we deal with the issues of myths surrounding, the COVID-19, and also get people to, take responsibility for themselves?
Yes, I've raised that in several fora, and I've said it very clearly. One, thanks to NTA and other media houses, we must first and foremost change the conversation here. The conversation when it comes to COVID-19 is the fact that it is something about the elite. In some quarters, something about the elite disease. Yeah. And whenever the media is reporting COVID-19, the media reports the WHO. When it comes to media coverage of the 5W and 1H, we report the WHO in it. Sometimes we just talk about Governor XYZ catch COVID-19. Yesterday we saw Pauline Talon, Minister of Women Affairs, caught COVID-19. We've seen, when we talk about the SGF, his 4 kids coming down with COVID-19. We've seen governors coming down with COVID-19. We've seen the big names being killed by COVID-19. But several poor persons are dying. Just about a month ago, a nurse in Maitama died, and no one cares to even put it in the media. Sometimes when you go to the likes of this day dome and Gogalala Center, most persons who are there are the poor or the average class, because the rich people now, based on how government want to save costs, if I'm right, are receiving treatment at home and some centers. They don't just crowd them with everybody there. Now, if that is what is going on here, we must tell people that, change the conversation, that look, many poor people are dying. The second one, which is also very, very fundamental, and we must hit it on the head. Some religious leaders had come forward to say they do not believe in COVID-19. These are persons who control the minds of millions of Nigerians here that do not believe in COVID-19. Unless these persons change and change their conversation, their followers will believe that they are speaking the position of God or speaking from heaven, and their followers will likely not believe in COVID-19. Then there are also the general class that believe that, look, the death rate is not so much here. We know we saw deaths in Wuhan, we saw deaths in Germany, we saw deaths in Italy, we saw death in Sao Paulo and other cities in Brazil, we saw deaths in US, and the entire US election was built around deaths and infection in within their own country here. So I think at this time we must change the conversation and get others to try to believe and tell them the story from the angle of themselves and the downtrodden. If we leave the conversation for the big men up there and report all the news from big men catching COVID, the people who are down there will never believe that COVID is real.
Yeah, I like the point you're raising, really, about opinion molders who tend to tilt, this message to other issues and not, on the real facts on ground, talking about the religious myths and traditional myths that surround this issue. I'll give you a little example. I was at a place of worship on Sunday, and I happened to be the only one with a face mask because of that kind of belief also. But then, Doc, you were talking about the new strain of the virus. Can you give us a little bit of more of an understanding of what this new strain is about? There's a vaccine that's been going on now, and I'm sure implementation has started in some countries there. But this new strain, is it subversive to the vaccines?
Well, let me continue from the first discussion before I answer that question. When we talk of prominent people dying or being sick from coronavirus and focusing more on them, I think the message is that it does not respect anybody, and that it's not a disease of only the average person or the poor people. It's a disease of everybody. That is the message there. It is not that it is affecting only the big people and leaving the small people. But coming back to your question, what it means is this. Normally, viruses replicate. Replication means multiplication, dividing, increasing in number. And when they do, somehow, the offsprings sometimes become different from the parent viruses. In other words, the gene sequence in the offspring are different from those of the parent. And therefore, the properties of the offspring or of the new variant are different from those of the parent. This means that if, for example, a vaccine has been developed, which is the case in this case, and drugs have been found, they are trying, they have not really found any drug yet, against a particular variant. And then there comes a new variant that is totally different in molecular structure, in gene sequence. It means that that vaccine, that drug will not work against this new one. If, for example, the first virus looks like a ball, it's round like a ball, and therefore, when it sits on a host, it sits in a hole that is round, and therefore you develop a drug that can attack it. Now, if a variant comes and instead of looking around like a ball, it looks like a square, it means that the drug you develop cannot attack it because the shape is different. I'm simplifying it in a way that the average person will understand. And therefore, the implication is that whatever you have done to attack the initial virus may not work in this second one. And therefore, the vaccines that we're even talking about may be irrelevant at the end of the day.
All right, thank you very much, Doc, for that input. Now it's now time to go for a break on the program. We'll be back in just a moment, and don't touch that dial. We're still looking at taking responsibility for the COVID-19. We'll be back shortly. Welcome back. If you're just tuning in, the program is Nigeria Today, and we've been discussing the COVID-19 and taking responsibility. And with me is Dr. Isaac Akuma Boja. He's a public health expert, and Ikaru Ata, the head media and the Enlightenment FCT Enforcement Task Force on COVID-19. Now, Mr. Ikaru, what are the challenges in enforcing COVID-19 protocols in the FCT and its environs?
Yeah, thank you very much. I think the main challenge we have for now is the people themselves. Most persons who really do not understand what doctor and others are warning us against, that the current strain, the virus is mutating, and if we are not careful going forward here, we'll be having more complex puzzle. And I told those persons who are already getting excited that they will be getting the vaccine by next year to, for now, start to protect themselves, because even if the vaccine comes, why spend so much billion when you can go with the non-pharmaceutical approach and save yourself? That's number one. Number two, the current challenge now is that people really want to enjoy the most of the festivity. What we saw going around the past few days shows some persons who really were just so determined to enjoy the festivity. We shut down the popular Millennium Park. We shut down the Unity Fountain. We shut down as well the Jabi Lake Park, believing that persons will go home. But to our utmost dismay, these persons did not go home. They flood themselves into some shopping plazas, into some areas. Some even just hang around on the street, just trying to ensure the best of Christmas. And we appeal to them that please, the festivity is on. We know you want to enjoy the best of the season. You want to enjoy the best of Christmas and the New Year, but it's good to stay safe here. We've been warned by medical experts to please try and stay safe, that danger looms are out there. We talk to them here, and most times when we do the talking and everything, some persons are just extremely adamant. They just do not want to comply. Some business premises as well, even government offices, do not comply. Like I told some other person, come to NTA and learn. When you enter, you find so many washing points, so many points to even clean your hands, sanitize your hands here, and even in the studio here, we keep physical distance, I and the next guest here. And that is what we just say, look, let's do these things and we'll all be safe. But many persons are so adamant, they are so stubborn, you have to go around. And the other one, which is also very shocking to me and my colleagues in the task force, when we went around some point, you just see some persons averagely of 50-50 wearing masks and those not putting on masks. Before we highlight from the car to even enforce, almost everybody would dip their hand in their bags and put on their masks. And I told someone, why turn the mask to look like seat belts that you only drag when you see road safety personnel? Always ensure you have your mask on. When you get to when you are alone, or you are in your car alone, or you are in a safe place, you can remove the mask and interact freely. The whole thing is about behavior here, and the social component of the persons who really believe that COVID-19 is not real, or some who just want to actually do what they like. And most of the things I'm seeing on social media from even some close friends, some Abuja residents who have traveled to their villages, I don't know what they'll be bringing back to meet us here in January.
Well, it's a very pathetic situation you've just painted there, but one wonders, is there really a synergy between the FCT enforcement team and other states surrounding the FCT?
Well, I think the synergy we have, or the connecting point, is the PTF. The PTF gives the guideline, and everyone goes out to actually enforce compliance. We've seen Governor Yesin Wike of Rivers State warning churches that he may likely impose a lockdown. We've seen Governor Malam Nasir Ahmed El-Rufai of Kaduna State talking about the need for people to actually obey all the health protocols, going out with a full team here. We've seen as well Ondo State, we see Lagos State doing all input, shutting down nightclubs here. The synergy we have, the boiling point, is the rules given by the PTF, from where we all draw strength and draw directive and draw instruction on how to go out and enforce compliance. We have the synergy. The governors, they all met at the National Economic Council meeting chaired by Vice President Yemi Oshibanjo. FCT Minister Malam Mohammed Musa Bello was also with them. They all agree in principle that we must go out, join hands, collaborate to fight COVID-19. We from the enforcement end must actually do what those from the medical end tells us is appropriate to do, to actually bring down the virus, reduce the spread, flatten the curve, and if possible, get people to do what is right here.
Yes, Doctor, Mr. Ikaru, I completely agree with you. But then, my question really is, when you talk about synergy between states, yeah, the PTF is there as an overall guiding body, but then the peculiarities of enforcement in state A could be different from state B, and then coming together, having a place to come together and exchange ideas is what I'm talking about.
For now, the ideas they share those who appointed us, the FCT Minister Malam Mohammed Musa Bello appointed I and my colleagues under the structure of the FCT Police Commissioner Bala Chiroma. Every other person have their own component body here. They all draw synergy from that point where they meet, either as Governors Forum, either at NEC or whatever. But the truth about it is that we cannot have all of us coming because the peculiarity slightly differ. That's why I told people here that everyone must be on the deck now. The synergy you're talking about is a meeting point where we may all belong to some WhatsApp group, or we meet regularly to sit down to talk. No, we don't have those meetings here. But largely, the governors who are our bosses, they connect with the FCT minister, and from that point, they come back from their meeting and they give us directive to follow, and we all resolve that what the medical workers are telling us through the PTF, Dr. Aliu and the SGF, Mr. Boss Mustafa, is what we'll be going out to enforce here. And like my fear, if you permit me to say that very quickly, my fear is what someone, I have raised that in several events here, what someone called the COVID salad that will be serving, COVID salad that will be getting by January. People have gone to the villages from Lagos, Abuja, and very many endemic states, and with different strains, and they will mix them up in the village, and by January they'll be driving back to bring whatever they have as COVID salad. Like
yes, unfortunately, our time is fast spent on the program. But Doc, is community testing still going on? And to what extent would community testing help this time around, or do we begin to add some sort of random testing too?
Well, certainly community testing is going on. If it is not going on, we wouldn't be reporting any figures. Most of the figures we are seeing are the tests carried out in communities. But yes, there is need for more to be done, far more than we are doing right now. There are some states that are very active, like FCT, Lagos, and so on. There are also many states that are not active enough. They're not doing enough. They are testing only in convenient places. Convenient meaning in the state capitals or in the nearby local governments and so on, instead of them going to different local governments, different communities, different markets, rural markets and so on, to test, so that they will know what is going on in those communities. Because every part of a state is important, and people are living there. And you may find that the state, the part of the state that you are turning your back on, that you are not looking at, is the part that has the problem most. And therefore everybody should be tested. We should be more vigilant now. We should be testing more, and we should be looking for more cases. Ideally, the more you look, the more you should find. And the more you find, the more you should be ready to treat and get rid of the problem.
All right, so unfortunately again, I'd like to ask Ms. Aitaru, how involved are traditional community leaders, this second time around in the campaign against the spread of the virus?
I think they're very much involved here. From our own end, the FCT Minister Malam Mohammed Musa Bello, alongside the Minister of State Dr. Ramatu Tijani Aliu and the Permanent Secretary Mr. Olushade, called a stakeholder meeting where about 18 traditional rulers from the FCT gathered. We've also been engaging them so much. They've been much involved from the onset. To COVID-19 enlightenment, the community-based communication here, as well as several others. What we are bringing on board, which is fresh at this time, is to get more youth groups and more CSOs and more NGOs to get involved in the process of the risk communication that will be telling people within communities and within groups going forward here. They are very, 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 very much involved here. But we're only praying that Khan is so much involved. The leagues of Imam, the leagues of Ulamas are very much involved, and we are just praying that one or two of these critical clerics that are out there saying it's not real will actually look the other way and join the process, so that we can quickly come together with many persons joining on board to fight COVID-19, and we flatten the curve and defeat the virus.
We believe that the impact will soon begin to show in the numbers coming out from the NCDC. But Doc, I'm going to be asking this question in two stages, and I'd like you to give me just in 2 minutes. What is the best approach in controlling the spread of the virus, during this festive season? And do you foresee possible lockdown if the number keeps continue to rise? In just 2 minutes.
Yes, of course, the best way of preventing this disease is doing what we are just saying that we should be doing: washing your hands frequently, wearing your face mask, especially when you go out, keeping physical distancing from your next neighbor. If you could do those 3 things, simple things, we will be okay. Whether or not we will have another lockdown, I wouldn't doubt it. The way we are going, my own recommendation personally is that if we can't discipline ourselves, the authorities have no choice than to do what is necessary. That is my recommendation.
All right, thank you very much, Doc, for that insight. Now, this is all we can take on today's edition of Nigeria Today, and the topic had been COVID-19 and taking responsibility. My guests have been Dr. Isaac Akuma-Igboja, public health expert, and Mr. Ikaru Atta, head media and enlightenment FCT enforcement task force on COVID-19. Thank you very much, and to our viewers, thank you for tuning in. Nigeria Today is live every weekday on NTA News 24 at 7:30 in the evening. You can also watch this and other editions of the program on www.youtube.com/NTA News 24 Hub. My name is Chimubi Walter Naji. Many thanks for watching.